Thank you so much. All right, so welcome everybody. I'm sitting in for Carol while she's out. My name is Anna, and I am a lead scientist with the Survey and Qualitative Methods Core. And so we're having everyone join today for one of our seminars. And so this seminar is being given as part of the UMB HCC partnership. And our group is the Research Design and Analysis Core. And so what we're going to do today is have our wonderful colleague Brett Nava-Coulter come in and chat with us about using cognitive interviewing for survey refinement. So as many of you know, we do a number of these seminars, largely during the academic year, but we do these to highlight different topics that are really methods focused and provide tools and kind of assist in the research process is being conducted throughout the partnership. So each one of these seminars is recorded and then we post it on the website. If you haven't had the chance, we have older seminars posted there. So take a look, reach out with any questions or ideas for future seminars and things like that. We're always here to help and chat about anything folks might need. In terms of just housekeeping stuff, I'll keep an eye on the chat so we can pause as needed, if that's comfortable for you, Brett, and kind of ask questions along the way. And we'll also have time at the end for a question and answer period as well. So I'll do a quick introduction before we jump in, just in terms of Brett. He's one of my favorite people, and he's an old grad school colleague of mine. He's a sociologist, has extensive experience with qualitative research methods. He's our in-house cognitive interviewing expert. His work focuses on a wide variety of areas: health, gender, sexuality, interface design, and improvement. And prior to joining our group here at Dana-Farber, he taught sociology at Tufts for 15 years. He got his BA in sociology from the University of California, Berkeley, and his master's in sociology from Northeastern. And without further ado, I'll turn the floor over to you, Brett. So thanks so much.
Hey, thank you. I'm going to share my screen and make sure that you can see it.
You're good to go.
Great. All right, thank you everyone for joining me today, and also Happy Nurses Week to everyone who celebrates. So I imagine each of us has had the experience at one point in our lives where we gave instructions either to a student, to a patient, to a driver, and uh, and then they experienced our instructions in a way totally different from how we intended those instructions to be understood, through no fault of their own and through no fault of our own. And that really is at the crux of what cognitive interviewing is meant to deal with. So today we're going to be talking about cognitive interviewing and its role in improving survey design. So I'll be talking about what cognitive interviewing is, when to use it and why it's helpful. I'll talk a little bit about types of approaches and then a little bit about how to record your responses and to revise your instrument. Things we won't be getting into today really are about the subsequent pilot testing, and we won't be getting into interviewing techniques. But if that's something you're really interested in, I just want to emphasize that that's something that we at the SQMC are here available and ready, willing, and able to help you with. So if you're looking for more in-depth training, if you're looking for more information about the broader process, please feel free to reach out to us because we're here to help you with that. All right, so let's get into it. So cognitive interviewing is a qualitative method used to understand how respondents interpret, process, and answer survey questions. So it helps identify problems before large-scale fielding. And so really at the heart of it, it's answering these core questions. So do your questions make sense to your target audience? Do the questions collect the information that you are intending to gather? Are your instructions and terminology understood in the same way as you understand them by your target audience? Is the instrument that you're using suitable to the population? Are you using the best possible language for the setting in which you're conducting your research? And is there concordance between your respondents' answers and the answer options in your survey? So again, the primary purpose here is to investigate how well your questions perform when they're asked of your target population. So, at the core of it is, do respondents understand the question correctly, and can they provide accurate answers in the way that you've structured your survey? In thinking about, when do we do this? this is coming in the middle of sort of your process, right? So you've already defined your construct, you've already described what you're measuring, you've already identified what the key attributes are. And then you've also already generated your items, right? You've created your measurements for each of your aims. This is the point at which you should be doing your qualitative assessment, going in, identifying your target population, and then essentially testing it with a subsample of them. Then, of course, this will be subsequently followed by revising your items, and then, of course, later on you'll be doing your pilot testing, in which you are, seeing if your distributions are performing as expected, where you're finding if there's over or underutilized categories. You'll be finding if there's items of non-response, etc. So the cognitive engineering is really coming at the middle of this process. But in terms of, when should we be employing this methodology? It should come, anytime you are writing new questions, uh, but also anytime you're adapting questions or measurements from another context. So if you are taking already sort of validated instruments, but you're modifying them in some way, or if you're applying them to a new population, you should absolutely be doing cognitive interviewing. And then, of course, you should be doing it anytime you do revisions to confirm improvement. We don't want to be making the problem worse with our corrections or our revisions. So you want to be testing anything that you change to your instrument. And then, of course, before pilot testing. Okay, so why is it useful? What can it detect? Each of us, I'm sure, knows that, of course, we should be reviewing our instrument after we've written it to make sure there's no, spelling errors or things like that. Each of us, I'm sure, knows that we should be going through and clicking through our red cap survey to make sure that our branching logic works. But there are a couple of sort of pernicious things. There are actually a number of pernicious things that may not be sort of manifest that cognitive engineering particularly can detect. So the first is ambiguous wording. Now, any layperson can tell you, can give you a definition for something like regularly, often, or recently, right? These are common words that we all know and are used in common language. However, if I'm a respondent, right, looking at a medical survey, right, a survey that my doctor has given me, I don't actually know what my doctor means by regularly, right? I have an idea of what I mean by regularly, but what is my doctor actually asking me about, right? So I may think of regularly as, once a month or every month, but what if my doctor is asking me if I recently had an allergic reaction? If I had an allergic reaction a month ago, perhaps to me that's recently, but that might not be recent to my doctor. And so cognitive interviewing can help us detect these sort of ambiguous wording where people may not understand specifically what you're trying to capture. It can also help us identify double-barreled questions. These are questions in which we're asking essentially two different questions within the same item. So the example I provided for you here is how satisfied are you with your pay and your work environment? Now, I may be very satisfied with my work environment, but I may not be as satisfied with my pay. And so how do I actually answer that question? So cognitive engineering can help us identify these moments where we've actually integrated two different questions into the same item. It can also help us identify unclear reference periods. So, for example, if I say, in the past year, how often have you had knee pain? A respondent may not know if you are referring to uh, as of January 1st, 2026, or do you mean as of May 14th, 2025, right? So we can identify these moments where it might be a little bit ambiguous what we are referring to in terms of the reference period or the time period. And then last thing is response options that are incomplete or overlapping or poorly ordered. So the example I provided here for you is, the options are A, 1 to 2 days, B, within the last week. If I had symptoms, 3 days ago and 2 days ago, how do I answer that? Because it's both A and B. Now, it may be more obvious if we're thinking about time periods, but there are other ways in which we might not be expecting response options to overlap. Let's say if we're talking about symptoms or if we're talking about sort of other sort of conceptual things for our patients who are having this sort of lived experience, there may be ways in which there may be gaps, things that are missing, or overlapping items in the way that we've written the response items. And cognitive interviewing can really identify those moments. Now, beyond just how we've written the questions, there are also other elements that cognitive interviewing can identify. So even when our questions are accurate written, they're specifically written, et cetera, there are moments in which we can integrate sort of assumptions that may not apply to all of our respondents. There are times in which we can be using wording that might be socially sensitive. And also there might be cultural or contextual mismatch in meaning or examples. I was speaking with a colleague recently, and I was noting that she's from the UK, and every time someone mentions fanny packs, she giggles like a schoolgirl, and that's because the word fanny means something quite different in the UK than it does here in the United States. Um, Beyond that, she also was pointing out that in the UK, when people use the term Asian, they more often are referring to folks of South Asian descent or South Asian ethnicity. Whereas here in the United States, more often when we're using that term Asian, we're referencing folks who are either from East Asia or of East Asian descent. And so, just two examples in which cultural context actually can really reshape how our respondents are experiencing our instrument. And so I just wanted to provide a couple examples for you from real world examples of cognitive interviewing and the ways in which things get interpreted a little bit differently. So this first example here on the left, it came from an instrument that was asking, it was from a section asking people where they get health information from. And then this subsequent question, question number 12, asked a follow-up wanting to know how successful people are when they seek out health information. And the answer options for this question were just yes or no. And so the probe that we used for this cognitive interviewing project was, how did you come up with your answers for this question? And this is one of the responses from a participant. They said, quote, "It's hard to answer. I think about times I've looked, and if there have been times I haven't been able to get it. I usually use multiple locations, so it makes it hard to answer. I don't have one answer." So the respondent noted that sometimes they are able to find information about their medical question, and sometimes they're not, and also they use multiple sources. So the way in which the item was structured made it so they could not accurately answer this question based on that. And so we knew we had to shift and change this a little bit so that we could accurately capture people's experiences. The second item is from a survey asking respondents about their priorities or preferences when considering new treatments. And so there were a list of different sort of aspects about new treatments, and we probed on that as well. So the first and second ones for this were the potential short-term side effects, and then the second was the potential long-term side effects. And the probe that we posed to folks was, what does short-term versus long-term mean to you the way that it's used here? And then you can see there's a wide variety in how people responded to or think about the notion of short term versus long term. So the first person said short term means a month or two. Second said short term is like diarrhea, maybe a couple of days. Long term is constant and does not go away. Short term, this is the third person, short term is a few weeks, whereas long term is several months. And then the last person said short term is like 3 to 4 months. Longer term is more than that. And here the options were a Likert scale for this survey. And so you see, right, people interpreted long and short term in very different ways. And if we're trying to understand what is important to folks as they are considering new treatments, right, we are gathering really disparate information about how they think about what short-term versus long-term side effects may be. And so we knew we had to more clearly identify or define what we meant by this for the survey. The third on the right here is from a drug allergy survey. Respondents were given a list of allergic reactions and asked if they had ever experienced them. And then to help with this, because the PIs recognize, folks might not know the specific term for the allergic reaction they're having. So to help with this, they included images and descriptions of each reaction. But these could only be seen by placing a cursor over the answer option. And so there was these instructions, place or hover your cursor on the options for photograph and description of the manifestations. And then we asked folks, describe what you would do after reading these instructions. And these were the responses, some of the responses we got. What do you mean by hover? I'm using my phone to do the survey. And the second person said, I didn't even notice these instructions. Can you make them bigger? Um, and so this really highlights it's not just about how we've written the instrument. It's not how it's not just about how we've written the question, but also we have to be thinking about how are people going to be literally interacting with our survey, right? Are they going to be taking it on a desktop? Are they going to be doing it on their phone? Are they going to be doing a paper in a busy clinic, etc.? And so here we identified, oh, there's actually an issue with how most of our respondents are going to be taking the survey on their phones because they can't interact with the survey in the way we had originally intended. All right, so we've established why it is important to do. Let's talk about how we in fact go about doing this. And I'll pause here. Anna, any questions in the chat? All right, all right. All right, in terms of sampling, we want to be recruiting participants who match the target population as much as possible. Sometimes it isn't possible to get, the literal folks from the exact population that we're looking to query. But as much as possible, we want to be recruiting participants who match that. And this is because we want to make sure that we're gathering information from folks about their own experience and their own knowledge bases. If you're recruiting folks from outside of the population, essentially what you're testing is what is your hypothesis or estimation about what other people know, right? I'm not really interested in that. I want to know what you know, right? And so that's why it's so important to be getting people who are in that target population to the extent possible. You also want to be conducting multiple rounds. And that's because, as I mentioned before, anytime you make a change, you want to be testing it to make sure that we haven't made it worse and that we haven't addressed the issue that we were attempting to address when we made that change. The most common practice or standard practice SOP is 3 rounds. But you may find, there are moments in which, you really have reached saturation after the second round. There may be times when you need to go to a fourth round. But generally speaking, SOP is 3 rounds. And then in terms of your sample size, somewhere between 5 and 15 participants. Again, SOP is around 12 to 15 per round. But somewhere in that 5 to 15 participants round, depending on your situation and the resources available to you. And the reason why we have such a small end, it's because we're really trying to harness depth. We're not looking for statistical representation nor generalizability with this. We really are just trying to gain insight and gain depth into how participants are experiencing and understanding our instrument. And so that's why small sample sizes are more typical. Now, in terms of the process itself, there's sort of 3 different approaches about how you go doing this, how you go about doing this. So the first is concurrent, right? So this is in which you would have the participant read, or you would read to the participant the item, the question, and then you would probe immediately after asking that question. And you would typically use this in the earlier stages of design. And the benefit of this is that it really captures that sort of real time, as they're experiencing what they're thinking right now in this moment, before they've sort of lost their thought process. The one downside of this is that it does sort of interrupt the normal flow of how one would typically use a survey. And so you're not capturing that aspect of it. You also have a little bit of a risk of reactivity where, in the moment they're sort of reacting to something. Whereas if they had if they had sort of a moment to take a step back and think about the survey as a whole, they might have a different response to you. But what it does capture is that sort of real time, right now, the thing I'm thinking about as I'm interacting or understanding this question. The second approach is the retrospective. So this would be after they've taken the survey as a whole. And you oftentimes, typical use would be when the survey is close to final form. And the benefit of this is that it allows them to interact with the survey as anyone normally would. And also allows them a sort of a normal response process. It can also give you a realistic time estimate of how long it takes to take the survey, and also a realistic estimation of what the burden of taking the survey was. The one downside of this is that, respondents may forget their sort of initial reactions or thoughts, but there is that sort of give and take there. And then the last approach is the think aloud approach, in which respondents verbalize their thought process as they are taking the survey. So you have them literally articulate the thoughts that are coming to their mind as they're looking at the survey. And you would do this when you are sort of at that more open-ended stage, when you're looking for really open-ended answers, and when the process of cognition is really key to what you're doing. The benefits are there's absolutely no interviewer bias because we're not constructing the probes here, right? We are just recording what the respondent is thinking as they are thinking. And also there's minimal training needed for this, right? Because on the part of the interviewer, all you're really doing is recording their answers. The downside of this approach is that it's somewhat unnatural, where most of us, as social norms dictate, do not usually say everything we're thinking as we're thinking it. And it can also be quite burdensome for patients because, it takes a lot to sort of articulate everything you're thinking and for the duration of an entire survey. It's also a little bit, you can get off track with it. I myself am getting off track because there's a very cute dog walking outside of my house right now. Uh, and it can be a little bit harder to analyze because you just have so much data. But the benefit to this approach, again, you're getting that sort of open-ended, the cognition as it is happening. You're getting that data. All right. In terms of probes, there are four general types of probes that have specific goals, or rather specific elements that they can detect uh, within them. So the first are comprehension probe types, right? And so these questions are meant to capture, right, how the question is being interpreted. And these are really great for identifying terms that might be unfamiliar to our participants. Also, moments or concepts that are somewhat ambiguous to them. It can really sort of pinpoint those. It can also identify items that are simply too complex for folks to respond to. The next are retrieval probe types. So these are recalling relevant information. So this detects, items that are or data points that are difficult for folks to remember. Um, Moments in which we are essentially compelling our respondents to guess or estimate. So it's not necessarily accurate responses, but rather our respondents' sort of estimations about what the right answer might be. And then also it can detect methods that are somewhat ineffective towards recall. The next type of probes are judgment or decision-making probes. So these are trying to ascertain how answers are sort of arrived upon, right? And this can detect questions or responses that are difficult to calculate for folks. It can also detect questions that are biased or sensitive for folks to respond to, and then also can identify socially desirable responses. So these are moments in which people are giving us the answer that they think that they think we will like if they give it to us. So, for example, you know, if you're asking me about recycling, I may want you to think that I'm a good citizen, and so I will say, yes, I recycle every single time, and I perfectly sort all of my, paper from my plastics, and I've never thrown away a plastic bottle in my entire life. And really, what I'm telling you is, I want you to think that I'm a good person, when in fact I throw away my plastic bottles all the time, and I've never sorted a can versus a bottle ever in my entire life. Um, Just because we're recording, I would like to note that Brett Nava-Coulter, have always perfectly recycled from birth, and that was just I was playing a role there. And yes. Anyway, all right, our last probe type is response options. So this can detect when there are not enough options in our response options. It can also identify when there's overlap between our response options or if there's incomplete responses. So I just pulled some examples here for you of of each of these types of probes. So here you see examples of each of those four types. So some good examples of probes that we use all the time, in your own words, what was this introduction telling you? How would you describe the difference, if any, between follow-up of a previous problem or long-term surveillance? How certain of your answer are you? And then, were any of these questions repetitive? And that last one is, again, getting at something else. Actually, I'll highlight here for you next. In addition to probing on individual items, we also want to be thinking about the instrument as a whole, right? Because it is not just about the individual questions we're asking, but also the experience of taking the survey that we want to make sure is working for our target populations. So in addition to probing on the individual items, you also should be probing and revising other areas that are about the instrument as a whole. So you want to be looking at further areas where you need to specify or clarify what your objectives are with this survey. That can be really instructive to respondents. When they know what it is that you're trying to get at, that can really help them conjure and bring forth the most accurate and helpful answers. You also want to be looking at issues of order, and you want to make sure that you don't have built-in redundancies into your survey. Nobody likes that. But you also want to be scanning for ordering bias. So is there some way in which, because we put question 2 ahead of question 14, we're somehow changing the responses to question 14? So we'll be looking for that as well when we're doing our cognitive interviewing. We want to be looking at instrument burden. We want to make sure that we're asking folks about, their feelings about the length of the instrument or the length of particular sections. And then we also want to be testing for cognitive burnout, because if we are, looking for a heavy lift, it might mean that, when folks are getting towards the end of the survey, they're simply tapping out, and then we're not getting responses at all to our final questions. Or that by the time people are reaching question, 72, their answers just aren't as accurate because we've had such a heavy cognitive burden ahead of that. And then lastly, but I think equally important, we also want to be thinking about the limitations of what can be explored through this particular methodology. Are we in fact trying to gather data that simply cannot be gathered through the method of surveys, right? Is there another method that we should be employing to gather the particular information or the particular data points that we need to ascertain for our purposes? So that's the other thing that you'll be sort of exploring with your cognitive interviewing. Hmm. Okay. So we've got our probes together, we are entering the process, and we're interviewing a patient. So our recommendations in terms of best practices is that you want to be both taking notes during the interview. And when you're taking notes, you want to be noting not just what they're saying, but also any sort of nonverbal cues or any tonal cues, right? So if I have a participant who's like, oh yeah, I totally take my medicine every single day exactly at the same time, right? I need, as the cognitive interviewer, should be noting the sarcasm in that response and should be noting that in my notes as well. Because if I'm literally recording that, that's going to mean something totally different than how the respondent is in fact intending it. We also recommend recording the interviews when possible. I know that's an extra step in terms of IRB, but it can be really helpful, especially in real time, to help you fill out the notes later on and helping you to sort of confirm any sort of things that come up during the interview. So in that example, again, I can go back to my recording and be like, oh, right, I can hear the sarcasm in their voice, and then I'll make sure to record sarcastically replied, yes, I take my medicine every single day at the same time every day. You're then going to use both those notes and that recording, if you have it, to create summaries of the feedback for each item. And we're not as interested, I'll get into this in a little bit. We're not as interested in one individual's response to the summary as a whole, but we want to be looking for patterns across all interviews. So then after you take the notes for this individual interview, you'll then create a summary in some way that looks at the information across all the interviews for each individual item, and then also for the instrument as a whole. You'll then bring this to your team if you're working with a team, and then collaboratively identify problems and trends, and then also determine any adjustments and changes to the survey that may need. It can be quite helpful to work with a group of people because it's the sort of same sort of thinking with the cognitive interviewing. Many hands make good work, and so having working with others to sort of reflect on what are the patterns here, what's the way that we can simplify this to make this better, um, can be quite useful. Of course, uh, as the process allows. You'll make changes, and then of course you'll test those changes out in subsequent rounds, and you'll repeat the process until saturation. Now, this isn't even really a rule of thumb. I just wanted to provide you how we generally organize the data once we've collected it. So generally, we'll create a table that has a row for each item that we are probing on, and then we'll create columns in which we're collecting all of the responses. We then summarize the sort of feedback that we're getting, any questions that are emerging from that. We'll then have a column for suggested edits, and then a column for our subsequent probe. So, if this would obviously be for going into round two. If you were going from round two to round three, of course, the last column would be round three probe suggestions. And I just wanted to provide you a real life example. So this is from an actual cognitive interviewing project that we worked on. And I'll draw your attention to just the first row. So the probe that we ask is how easy or difficult was it to understand the introduction? And then you can see from the answers, all respondents said something like easy or straightforward. And then our comments for this was that there was general acceptance of the introduction for folks, but we felt that there were too few answers to eliminate the probe. And so we recommended keeping the probe for round two. So this is how we generally organize things. This is not a rule. You should do it in a way that sort of makes sense for you and works for you, but wanted to provide you just an example. Okay, so when you are analyzing your findings and revising your items, you are going to be summarizing findings item by item rather than person by person. We're less interested that in the fact that Becky, really understood the introduction, but had a lot hard time with all of the questions. What we're looking for again is patterns across interviews, right? So we're looking for trends in repeated confusion. We're also looking for subgroup differences. So while across many of our interviews, most of our participants had an easy time answering the questions, if you're finding that, all of the women in your interviews had an easy time answering questions, but all the men had a lot of difficulty finding the right answer for them. You need to be paying attention to that, right? So looking for those subgroup differences is really important. And then, of course, you're looking for evidence that wording leads to unintended interpretation. This is the crux of what we're trying to accomplish here. You'll then use these findings to make targeted revisions, right? You're going to simplify your wording. You're going to define the key terms that seem to be difficult for folks to easily understand or terms that are unfamiliar to them. You're going to be shortening your recall period so people can give you more accurate responses. You'll be splitting up those double-barreled items. And then, of course, you'll be improving your response categories. And then you'll retest and revise items in another round of cognitive interviews. So looking over the process as a whole, right, this is what this sort of looks like, right? So you design your instrument, you define your sample, you conduct your interviewing, you chronicle your responses, and you summarize your findings, and then you revise and retest. Revise and retest, of course. All right, I shall pivot here, but I just wanted to emphasize again. So things that we didn't get into today are techniques of interviewing. I didn't go that deep into analyzing and revising your instrument. But once again, if you're interested in learning more about this, if you're interested in doing a cognitive interviewing project, we here at the core are a shared resource available to you, that and many more things. So please feel free to reach out to us at any point. We're here to do trainings. We're here to advise. We can do everything from advisement consulting all the way up to execution and even analysis and distribution. And I just wanted to provide you all with our contact information. Many of you knew Carol. She's our primary contact. But we also have our lead qualitative researcher, Anna, who's here to answer all your qualitative needs. And then, of course, our survey methodologist, Gwen, who is here to answer any of your quantitative questions and more. She's also a brilliant opera singer, I've heard. So any opera questions or quantitative questions can be directed towards Gwen. Okay, I'll pause here and open it up for any questions.
Thanks so much, Brett. Really appreciate it. Really, really helpful. And I'm so glad you're able to walk through that today. Want to first just open it up to any questions that folks have on the call, whether that's kind of a general question or we have a little bit of time. So anything specific to maybe a project you're working on too. I'm happy to open that up. And Mara, I see you have a question. Your hand raised. Go for it.
Hi, Brett. Thank you so much for the explanation and presentation. It's very good, and I understand many things about what you explained. I think I have one question related to the proof questions. I know that you show many example of the question, and I think if like we have many items in our survey and like how you decide how many probing question that we want to have to make sure that the participant is not like burdening the participant and ensure that their answer is like what we expect it to be or like what we want them supposed to be. So I think that my question, and when we deciding like how many question that we want, is it also need to consider what is the purpose of the cognitive interview that we want to have? And yeah, I think that's my question.
Yeah, that's an excellent question. Yeah, so in addition to thinking about the cognitive burnout for the survey, we also need to be thinking about it for the cognitive interviewing process as well. Um, that being said, it is important. We want to make sure that we are probing on any question that could be interpreted differently, could have could be eliciting sort of estimations rather than accurate answers, and et cetera. And so I would really encourage, any question where there is technical language, any question in which there is um, what's the word I'm looking for? Um, time frames given, etc., you want to be probing on that. And one of the things that's a little bit nice about the cognitive interviewing process versus a survey is you are interacting with the person. And so you can give them breaks, right? You can give them moments to take a pause and so it's not as onerous or odious as it is with a survey, right? And they can in real time tell you, oh boy, like this is a lot. And you can then, in real time, sort of take that pause and give them those moments that they need. And that's one thing that's nice about the in-person thing. But certainly, yeah, when you're thinking about, what are the questions that I need to be probing on, anytime you're using sort of technical language, anytime you're asking about, Gwen and I are working on another one, we're asking a lot about types of medications that folks are using. And so we're probing on those, any kind of time periods. Um, etc.
Thanks, Brett. Brianka, do you want to chime in next?
Yeah, thank you, Brett. Really great presentation and really informative. For the projects that you all have been doing, how much do you prep your participants to sort of participate in cognitive interviewing? Is that a thing that you have to do, or
Yeah.
is it just going in cold?
No, so we actually there's an exercise that we typically use at the outset of the cognitive interviewing thing, and it's we ask them how many windows are in your house? And then we ask them to tell us how they went about that, right? And that's just a little sort of prep for them to get them used to this idea of like, okay, I'm going to articulate how I'm thinking about thinking, right? Um, and so that's just a little exercise that we have them do at the outset just to prep them for what this exercise is going to be like. And then, typically in our introduction, we'll do our typical consent. Um, and one of the things I like to emphasize is, we're not as interested about your answers to these questions, but rather how you think about the questions. We want to know, does this question make sense to you? Does the question seem unclear? Etc. And so that prepping, I think, is really important to sort of getting them into this exercise. But it's very quick. Um,
Okay, thank you.
That's great. Anyone else have a question for Brett about the cognitive interviewing process?
I have a question. Um, uh, if I'm developing a survey, but it's a mix of like surveys that have already been validated and then my own like questions I'm developing. And how do you view that process when I wouldn't really be open to like changing the wording of already validated survey. So I was originally thinking I would just not even show them those validated questions that I plan to include and only include the ones that I'm developing. But is there a reason to have them do all of them?
I would recommend doing all of them, in part because you want to be thinking about sort of, and there you're looking at the instrument as a whole. So thinking about like, cognitive burnout, thinking about the length of it. Um, Sometimes you'll also find that for your target population, the validated questions aren't working.
Hmm.
We recently were working on it was for weightlifting. It was an exercise survey. And we had it was just three items from a validated survey. And we found that one of them in particular, none of our respondents could answer it. And that's because it was a question about like, how hard are you working out? And there was a scale. And the respondents kept on wanting to understand what the objective scale was and then trying to ascertain like what their subjective experience was compared. And so that validated question was not working for the purposes of and so I would highly recommend, even though it's already validated, you may not want to be changing the wording for it, but you may find that this item it's not the right question for your purposes. And maybe you need to find a different one. So
Okay, thanks. That's helpful.
yeah.
Thanks so much. Mariah, you want to go next?
Yeah, sure. Quick question about timelines. I'm wondering for one round of interviews, what would a reasonable timeline be? I'm thinking from recruitment through analysis, and along with that timeline, what factors might impact the timeline?
It's all about recruitment. It is all about recruitment. I've been on studies that took 3 years because the people we were trying to recruit just they were not coming through the door. And then I've been in other studies where, they had folks who were ready, willing, and able, and we got it done in a couple of months. So it's just yeah, there's no one answer for this. It is about recruiting folks and then of course your own availability. Um, so yeah.
Got it.
Yeah.
Yeah, I was a little worried that would be the answer. I'm planning out a project right now, and so I'm thinking about, how much time to build in for cognitive interviewing.
Mhm.
But yeah, recruitment
Yeah, yeah. And if you want to talk about strategies around recruitment stuff, we can talk offline to
sounds good.
bribe them.
Thanks so much. Jennifer, do you want to go next?
Thanks. I'm a neuroscientist in the Cantor Center. I'm probably an interloper into this conversation, but
Welcome. We're glad to have you.
Yeah.
I just had a question. What are some of the most common problems that you see in your cognitive interviewing that you think are well written, but you're getting feedback that aren't? What do you uncover? Like, is there a common thing that's uncovered in particular survey items or?
Gosh, it really does run the gamut. The thing that first popped into my mind is we recently did this. It was looking at resistance training amongst folks, and the question was like, on in your typical workout session, how hard are you working out? And then it was a 0 through 10 scale, right? 10 being the most you could, and zero. And again, folks really had a hard time on like, because they had their own and they're like, well, I know what's hard for me, but maybe that's not hard for you. And so I think it is, and maybe this is at the crux of why cognitive engineering is so important. The lived experience of our target populations is specific and unique to them. It's why we're surveying them, right? Because we want to know what they know. But it really, it's the things that you don't know that you don't know. And so I don't know that I can point to one specific thing. Maybe in the context of medical surveys, it's when we're using really technical medical language, and that's just not how folks talk. But it runs the gamut from, I don't know what the time frame you're referring to, or I've always gone to see I've always gone to see an herbalist, and an herbalist is not one of the answer options about who I get medical information from. It really is just a wide array. And it's sort of that's why cognitive interviewing is so important because their experiences are unique to them. So,
Yeah, and building on that, Brett, one thing that came to mind for me was a lot of the work where we've done where we've altered the types of examples we include
mm,
in terms of, really adapting those to the population we're having there. And in some cases, kind of, really changing the examples that were existence before. And so making those really applicable to the population who's taking the survey because sometimes the examples just are not ones that came to mind for folks. And so one of the probes we have is around kind of what examples do you think would be most helpful to include here? And I've always found those to be really insightful for kind of the experience that folks are having.
yeah. The other probe that I think I love and I use maybe too often is what does this mean to you in the way that it's used here, right? So it gets that framing gets out of like I'm not testing you on what does this mean. I want you to tell me like what you're hearing, and that can be really insightful into how folks are understanding something.
Any other questions before we finish up today? All right, well, I just want to say thank you again. Thank you, Brett, for taking the time to present on this. Thank you for all of those in attendance. We have this recording and we will post it on the site. And do reach out with any questions you have, big or small. We're always happy to chat on any of these topics at hand. So appreciate your attendance today and hope you all have a wonderful rest of your week and weekend.
Bye, everyone.